Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hana
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to Healing Through Dentistry. Today, from a car straight after we have arrived from Boston to Vienna. So we would like to share the takeaways which we are bringing to Europe from Professor Ganati knowings and experience and findings. And he's actually German, so we're bringing the home messages to Europe. So, Hana, we love that. We love the community. We love the shared experience, and we would love to share what is the most important in viewpoints. But what was the course about? So, past 2 years, we're educating ourselves in ceramic implants and surgery. And Dr. Ganati, he is the best in the world to learn from. But we won't be talking about the surgical procedures. However, we would like to say what is the most important to focus on.
But before you
in
start,
healing.
I would like to maybe touch on why do you think that Professor Ganati is the best? And I think not only for his clinical skills, but most importantly for collecting data and doing research. So he is writing articles, he is putting a lot of data together and clinical trials. And I think that's what's very important for the whole industry. So they see that it not only works for him when he does it clinically, but actually he's got it supported with data and research.
And only this way we can transform the old dentistry, supporting with the data. So anyways, the most important in a healing journey, which lots of us is on, is to find the source of the problem or issue. So the source may be sometimes hidden, and that's where we can help. So this is something which many of us would not see and maybe would not think about, that there are areas in our jaw where they can cause problems. So we were talking about not only root canal treated teeth, dead teeth, but we were talking also about residuums of covered areas, which they can later on the samples could be sent to pathology, and they could announce that there is chronic inflammation cells that would prove that there is infection.
Yeah. So the very old term for it is NICO. You may have heard NICO, you may have heard FDOK, or you may have heard cavitations, but the latest term we'd like to use for it, and I think it's accurate, is closed socket residuums. And it's for that reason,
socket residuums, yes.
Yeah, that when the tooth, or let's start like that, like the biggest myth, what Professor Ganati actually put in a research and in a data, and the biggest myth, what we kind of thought is that when you remove the tooth, the blood will change into the bone and it will close the socket or the space without the tooth. And he, with his data, he is showing us that's not the case. So that's why we then see on our diagnostic tools, 3D scans, CBCTs, that there are spaces of hypodensity or sometimes hyperdensity, meaning, more dense or less dense bone. And that is an issue because obviously these are the spaces where bacteria, toxins, metals, parasites can hide and can and are causing systemic issues.
And I love that also he has data about what specifically bacteria and viruses and what spectrum of pathogens is found in the bone. So I like to recall it as hidden issues which are causing the sources which are causing the systemic problems. So the takeaway home message for all of dentists and biological dentists would be to clean the sources, which are the areas which are
bone.
or hyperdense.
Which is
Yeah.
bone, right, Eva? So clean the bone was the mantra.
And more you clean, more you are giving the body the chance to heal. So that's profound because we also have, and I would like to add some client stories into this talking because that's what we love to talk about the most. So if you release these blockages, you will find out what the body can do. So recently, like before we came to Boston, I had a client who told me that after the surgery, she had 4 root canal treated teeth, dead teeth, which she was not really aware of. She said she has been having the root treatment done a decade ago. However, she was on a journey to heal because she has lots of issues, medical issues. But what she didn't tell me when we met, because people, they start talking about what improved once it's improved and they kind of forgot what it was. So she told me she couldn't, her arm was so stiff that she couldn't pay for a parking ticket. So she couldn't place the parking ticket in the machine. So, and now
because the movement was so painful, which is like for most of us, it's like, what do you mean?
yeah,
Like, how can it be something so painful so you cannot extend your arm and pay your ticket for things, casual things like paying a parking ticket?
Yeah.
So I was like, what? I was shocked when I heard that.
The other thing was that her knee was swollen all the time. So that is gone too. But what really was fascinating was straight after surgery, which is, 4 months ago, straight after the surgery, she has written us email with the feedback that she was very afraid of heights, climbing the ladder, going to see the viewpoints. And she wrote us email, which surprised also, she was surprised that she picked all the apples because it was autumn. She went to some viewpoint to just test the height and, this disappeared. So the stage of panic was gone. So that was immediately. And then 3-4 months later, she was telling us about these parking tickets, kind of movement, the arm and the knee. So I love that. We have to say, and this is the takeaway from the course also, is that the healing journey is for everybody different. What is the protocol and what is very important for people to know is that very important is what we drink and how much we drink. So a healing journey should be full of good water, good nutrition, because these clients who are on a healing journey, they are healing. Some people, they're healing over the time. Some people straight away, but all of them are connected with the fact that they are eating well, real food, and they are supplementing vitamins and minerals.
And I'm glad that you added the water as a highlight, because in our protocol, we advise people to start drinking more water, or like be mindful of drinking water, ideally filtered one, from a good source, 4 weeks before the surgery time. It is very important because if the body lacks hydration, meaning if your cell is just tiny because you're dehydrated, nothing can actually work, right? So we do advise our clients to drink a water 2 to 3 liters a day, like 4 weeks before surgery time. And it's not only like, we can see it even today, Eva, right after a long haul flight, how dehydrated you are.
Yeah.
And how desperate for water I am right now. We also see it on our skin, how everything's like shrinked, how all the mucosa is dry.
And the wrinkles are visible.
And the wrinkles, normally not visible, are visible. And also, like, the fact that we were showering with a different water just makes a difference. I think we've touched on it in a different episode, that we both do have and also in the surgery, we do have a filter for our water, for the main source of the water. So obviously we do use it for like showering, for, making a bath, but also obviously drinking. And I can see even after a few days how my skin is so dry and
Not
obviously not healthy, because most of the water full of, chemicals and particles. So yeah, I just wanted to jump in and add this. And also I'm happy, Eva, that you stressed that everyone's journey is different, because sometimes, most of the times people just expect it's going to be like, we do have a magical wand, we remove all the infection and everyone's fine in one day, but that's not the case. Sometimes it is. Sometimes we see, like Eva just shared, that people do experience breakthroughs, health breakthroughs right away. But most of the times, or, the resolution of the symptoms is over the months. Because obviously, if you do deal with some kind of a symptom issue for many years or many months, we can't even, common sense is that we cannot kind of predict that it's going to be gone in like one day.
And you're changing the microbiome, which is
Right.
fascinating. We see, because if you have dead teeth in your mouth, it's not just functional. This is not just the fact that it's dead, but it's changing the microbiome. So we see over the time that perhaps it changes the way that you have lots of plaque 1 week post surgery, but the next week, following week, is clearing so beautifully, and over 2 months is, you would not believe how the gums, they are beautifully aligned towards the teeth. So
Well, I'm glad that you said that, Eva, because this is really important, maybe to stress again. Amalgam fillings, titanium implants, even like wires after braces, so-called retainers, which are metal, do influence your microbiome, your oral microbiome in your mouth, meaning it influences the whole body, because obviously microbiomes, it's, like we often hear about gut microbiome, but that's the very same one as in your mouth. Like it's like the body's, we're one big microbe, right? Some microorganisms in our body everywhere. And it's very important to have it balanced, meaning the good bacteria you want and they, work for you, but the bad bacteria don't work for you. And what we see a lot is that when people do not, let's say it this way, in an ideal world, if you do the surgery, we want to do stuff at one go. Like, let's say some have 4 cavitations, 2 root canals. So perhaps it's best to do it in one go. If you decide to have only like one side or one root canal done, it is obviously very good for your body, that you're just going to get rid of a big infection, and, you're just going to let the body breathe a little bit more, so-called breathe a little bit more. But same time, the microbiome in your oral cavity, and meaning the whole body, is still going to be compromised. And same with amalgam fillings. That's why we do have our phase 1 in our surgery, is to remove all the metals first, or like, let's say, even from the beginning, right? So it's a dental hygiene, so a deep scale cleaning, dental hygiene care, basically, that included ozone therapy. The second stage is removal of all metals, so be it amalgam fillings or metal fused crowns or retainers after braces. And the third stage is surgery. And of course, it is individual, so we can do it in quadrants, meaning we start on the right side, so we can start, if there's an issue, on the right side, lower right, upper right, then lower left, upper left.
according to energetic flow,
Yes.
in a man, it's we're starting lower left, following upper left, and so on. What I would add, and we can start all doing immediately to change the microbiome, is to rinse with salt water. So that's a home message, take-home message as well.
which we've done always like and recommended.
Yeah, and supported by the data as well by Professor Chakrun, who is big on
BRF, plasma,
or plasma concentrate or blood concentrates.
but also Professor Ganati now.
But also Professor Ganati, he supports that too.
We were very happy to hear that.
Basically explain it to our clients the way that if you rinse with salt water, you're changing the alkalinity in your mouth. So the alkaline supports the good bacteria, and the bad ones, they don't thrive in this environment, so they disappear.
So we've got a feeling that we got disconnected. So I've got a feeling, Eva, that you might need to repeat the salt water, why salt water. And
so I'll summarize why to rinse with salt water. We are changing the environment in our mouth into alkaline. The alkalinity favors to good bacteria, similar to eating vegetable, that's alkaline too. And the bad bacteria, which they like acidity, they disappear. They don't thrive in this environment. So naturally they disappear. So we see beautiful results, after a few days, 1 day, 2 days, 3 days. It's just profound what you see. So you can try at home, start rinsing with salt water, 1 cup, 1 teaspoon of salt. Okay, so thank you for listening. A little bit interrupted by the reception. And we are glad that you're with us, and see you in the next episode.
See you next time.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being. To stay connected, visit us on our website or follow us on social media. If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit. Until next time, remember, healing starts with a smile. Take care, and we will see you in the next episode.